Yes, ma'am. We are live.
Dr. Pushpalata, we are beginning. Okay. Hi everyone, I am Varidhi from Careers 360 and I welcome you all to this webinar on how to find your best fit MBBS college. We know that the NEET results for 2022 have very recently come out and you all must have a lot of questions about how you should go about choosing the right college for yourselves. And to answer all your questions regarding this, we have with us today Dr. Pushpalata. Welcome you and thank you so much for sparing your time to do this session for us. So a brief introduction of Dr. Pushpalata before I request her to take over. Dr. Pushpalata is the professor and head of the Department of Anatomy and the member secretary of Medical Education Unit. She trains not only medical students but also students of dentistry, physiotherapy and nursing. She received the FIMER Fellowship in 2012 from PSG Coimbatore and is pursuing PhD in medical education at JSS Academy of Higher Education and Research. She has organized multiple workshops like mentoring, faculty development, program, designing MCQs, and workplace-based assessment for in-house faculty as well as that of other institutions. She is a curriculum committee member at JSS Academy of Higher Education and Rajiv Gandhi University of Health Sciences and has multiple publications to her credit. We welcome you once again, ma'am. And with this, I would request you to take over and take us through your presentation. Post the little presentation, we will throw open the floor for question answers for students and you.
Thank you, Varidhi, for your brief introduction. So let me just share my. So is my screen visible?
Yes, ma'am.
Yeah. Okay, just a little bit of just introduction. So after that, you have any questions, you can, in between, you can ask me or just in a 5 to 7 minutes presentation, then we'll take up the question and answer part. Okay, just to brief you about the medical colleges, as you can just see the state wises. Totally as of today, there is a 612 medical colleges. It is just for a tentative because sometimes it keeps changing. NMC keeps adding the colleges and number of seats. It is just as of today, I'm just giving you the statistics. Okay, so totally 612 colleges are there. So in that, government medical colleges are 322 and the private 22 plus are there, deemed to be university. So 46 plus and private universities around 10 plus colleges are there. This is in the country. Okay, so 92,793 seats across the India. Government seats in government colleges is 48,000 plus seats. And what are the categories? What we can have is, so this is only government seats in a government colleges. The others also in, there will be government seats in private colleges or private university and deemed to be university. And there is a category called higher fee seats in private colleges or management or NRI seats in private colleges. And there is in the deemed to be university, there is a regular fee seats that's also on the higher side and NRI seats. These two are there. And the why I put it a red here is the government colleges, private colleges and the government seats. Okay. And the management or NRI seats in private colleges are, you have the respective state counselings are there for deemed to be university and all India quota. So there is a all India counseling is there. Okay, so that is conducted by the medical counseling committee. That is all India quota 15% and deemed to be university 100% of the seats by these MCC. The rest of the seats, it's a respective state counseling. So they have the counseling. Okay. So now first thing is you have a doubt that how to select the colleges. Okay, for this I would suggest you. So first thing is, first you see whichever state you are, first see what is the cutoff score for the last year for your category. There's a lot of category seats and things like that are there. So for your category, which is the last year's cutoff score, okay, according to that you can plan. And also, which if you feel some colleges you want to find out, every college there's a website, informations are there. You can search in the Google. Okay, and there when you go there, please look into the NAC scoring. Okay, the accreditation NAC board is there and NIRF rank status of each colleges. You can see in their website. or you can take the feedback from the, if you know from family members or anybody, if they have studied in those colleges, or if you know anybody alumni from that college, you can take their feedback. And another important, when you're choosing the colleges, so when filling the choices in the counseling is very, very crucial. Okay, so it is that you should be very careful when you're choosing the colleges. Okay, so and choices, because especially in the all India counseling, for every round you need to change your choices. But for the state counselings, probably first what you fill the choices will be your permanent till the final round. So that is why before finalizing your choice filling, be careful and finalize with somebody. If you have some professors or anybody whom you know, please contact them. I think the 360 is also there to help you out. So then you can fill it. So for All India Counseling, this is the website. I think most of you are familiar with this. This is a medical counseling committee. Okay, so keep seeing the websites of the counseling sites website every now and then. Please keep checking this. Okay, and this is what the tentatively they have released the date. Okay, so for now you need to register for All India. Okay, you need to pay the fees. Last year it was 2 lakh. Probably this that is for deemed to be universities. For a government seats, only 5,000, and that is refundable. If you don't get a seat, or even if you get it, that is a refundable amount will be there. Okay, so this is how usually it will be announced in their website. So keep checking for the every day, at least once you please check the websites. Okay. And another important information I wanted to give you is, so if you're Indian student, they want to claim to be an NRI seats. Okay, so that should be, these are the documents, some of the important documents. You should be ready with this. Okay, so that is the passport or the visa of the sponsorer. Okay, and be careful now. It is the sponsorer should be only the blood relations are can sponsor, not the friends or anybody. Now only the blood relation, and that relationship with the NRI, that has to be, the documents should be there. Okay, and also the affidavit from the sponsors should be there. That is, they are going to sponsor your full course fee. Okay, and the embassy certificate of the sponsors. Okay, and also your NEET scorecard. Okay, so whenever you're thinking of the NRI seats, be ready with, if any of your blood relations are there, so only they can sponsor. Okay, so when you're selecting the colleges, so just tell you brief about JSS Medical College, that is Constant Colleges of JSS Academy of Higher Education and Research, which is situated in Mysore, Karnataka. Okay, so it is a spiritual center which is started by a spirituality leader. Okay, so this is the present pontiff we have. Okay, so why I would say that, why I'm showing all this, so that all these things you should be able to see in each college website, and you can decide which is the best college. Okay, so here these are what are the departments, and we have 6,000 plus students across all this. We have 7 departments and 4 constant colleges, 2 pharmacy, dental and medical. Okay, and we have a faculty and students publication also is there. Okay, we have 900 plus researchers are there. Almost 150 plus courses are there. Okay, so this is our facility at the JSS hospital. So one of the, and you can see here one of the skill and simulation lab. So you'll be learning with the simulations. Okay, so you can see here all this is from our own institution. And also there's a virtual reality based robot assisted learning. Okay, so whenever you see any colleges, please see to it that what are the facilities available there, how is the infrastructure, take a feedback, and then you can select. Okay, so this is the ranking system which will be displayed on every college. Okay, so this you can make a note of it. This is what I'm putting it from JSS Academy of Higher Education and Research. Okay, so the medical college is the 34th in the NIRF ranking of this year. And this is a ranking of the other, and the university stands as the 34th in the country. Okay, and we also have a global partners. So all this is actually displayed in the website. So this is the strength of our JSS Academy of Higher Education and Research. And I would say that don't ever only think that, don't get disheartened if you don't get MBBS. There's a lot of other things, okay, which will help you, okay, to pursue. So other than MBBS, there is a BDS is there, physiotherapy, Ayurveda, pharmacy, speech and hearing is there, nursing, yoga, and another important now it is the coming up is the BSc Allied Health Sciences. You can see this, all these courses. We run all these courses. Most of the deemed to be universities have all these courses. You can see the Bachelor of Occupational Therapy, Forensic Science, sorry, cardiac care technology, emergency medicine technology. You'll be like working with the doctors in the hospital. Okay, it is like a allied health people. It is now it is nowhere only doctor cannot treat a patient. You need a holistic approach. Okay, so we need all this support of this anesthesia, operation theater and technology, optometry. There's a perfusion technology, renal dialysis, respiratory care technology, genetics also is there, and medical imaging. Okay, so this is how we can. So this you can see here. You can see these are all the allied health students. They are working with the patient. They are working in the ICU everywhere. You can see. So you'll be in the hospital working with the patient. So don't get disheartened if you don't get a medical. Okay. So thank you. So now I am ready to answer your queries. Varadhi, it's open for discussion.
Yeah. Okay. Thank you, ma'am. Okay, all the students who have some questions to ask Dr. Pushpalata, please use the reaction button to raise your hands and we will give you a chance to unmute and ask. So we have a question from Ravi Ranjan Kumar. Ravi, can you please unmute yourself? Dipandita, can we unmute Ravi? Seems okay.
Yes,
hello,
Ravi.
ma'am.
Yes, Ravi.
Yes, Ravi.
Ma'am, I am from Bihar.
Yes.
And this year I got 585 marks in NEET.
Okay.
I want to know that can I get a MBBS college or not?
Yeah, you were 585. What is your rank, pa?
Rank 28,065.
Yeah, definitely. I think you will get it because you need to see in your state what is the cutoff last year. So probably according to this one, I think you will get. I think Varadhi, your say on this?
Last year, my state cutoff is 604 for OBC category. I am also belong to OBC category,
Okay.
but I want MBBS seat from All India quota counseling this year because
yeah, All India. I think you will get it in All India. I think this rank you will be getting. All India you will get.
Okay, man.
Varadhi?
Yeah. So Ravi, if you still have some doubts, so please just drop in your email ID or your phone number on in the chat, and one of our counselors will reach out to you as soon as we can, right, at the earliest. So just drop your email ID, please, in the chat box.
Okay, ma'am. Okay, ma'am.
Yeah,
okay.
And one more thing is, Ravi, you should be able to go any part of the country, so that definitely in All India you will get for this score this year. That is
okay. Okay, ma'am. Thank you.
Okay, we'll get the next. Okay, next question we'll take from Priyanshu. Priyanshu Das.
Hello, ma'am.
Yes, Priyanshu. Yes.
Ma'am, I'm Priyanshu Das and I'm from Odisha. Ma'am, I had a query that can we change our category during the counseling, especially the state counseling?
You're from which state? Orissa. I think no, because in the state counselings, what I have seen here in the Karnataka state counseling, you're not allowed to change your category or choices of your colleges once it is finalized in the first round. Mop-up round, they will leave. Okay, sorry, the mock round. The mock round you can change, but after that, you'll not be allowed to change. I think Varadhi can say about the Orissa state. How is it?
So again, ma'am, our expert counselors will have to reach out to them. Priyanshu, please drop in your email in the chat. Priyanshu, okay, he's muted.
Yeah, he's muted.
So next question from Sanjana, please.
Sanjana, you can unmute yourself.
Hello, ma'am.
Yes, Sanjana.
Ma'am, I'm from Odisha, and this year I scored 519 in NEET.
519, 19.
Yes. My
519.
rank is, yes, ma'am. And my rank is 69,662.
Okay, so because your state, I think you need to see the each state cutoff rank. What was the last year? If you know, you can just tell me.
Actually, now 2 new medical colleges have been granted the permission to take allotments from this year in Odisha.
Okay.
Uh,
Ready to move
And
out, or you want to be only in Orissa?
no, I would more like to move out, but I don't think at this score I would get any seat in the All India quota council.
Yeah, if you are ready to give deemed university, definitely you will get deemed universities. You will be getting, but if you are ready to pay the higher amount fees, you will definitely get deemed universities.
Achha. No, deemed university we cannot afford.
Deemed university?
We cannot afford. I mean, our family cannot afford.
Okay, okay. Then you can just try it in the first round, because you'll know in the first round itself whether you'll be getting or not.
Okay. And there are also colleges in different places like Baripada, Balangir, Baleshwar, where the cutoff is comparatively low. Like last year for Baripada, it was 540 or something.
Okay.
So
No, that's not
yeah.
because
And
this year, yeah.
this year I don't know, ma'am. This year the cutoffs have not been released, right?
Yeah, no, it's just a prediction. I think as they said, you can just put your email ID. So one of the 360 career person might contact you.
Ma'am, I had a question that if not MBBS, what else can I try with this scope?
Definitely you'll get a BDS. So that is not a good option. There is a physiotherapy is there. That's what I was telling in the presentation. So there's other options where if you want to be only in a science and medical background, you want, definitely there's a lot of scope is there. Physiotherapy, speech and hearing. Okay. All Indian speech and hearing is there. Okay. That is Ayush. And also in if you want to go to the pure side, the Indian Institute of Science, there is a option is there. So a lot of things are there. Even pure science you can take. Just don't get disheartened if you don't get medical. Okay. There's a lot of other
Yes,
career
ma'am.
options are there.
Are these all available in Odisha?
Orissa, yeah, I think they're available.
Okay. Then at the time of registration for counseling, I have to apply for all of them at
Yeah,
once.
state counseling, state counseling. That is the state counseling. All India counseling is only for medical and dental.
Okay. Yes, ma'am. All that's clear. Thank you, ma'am.
Next, I think Krishna. You can unmute yourself.
Yeah, I'm one of the parent of the student. All right.
Yes, sir. Yes, sir. Sorry. Yes.
No problem. My daughter secured 485 marks, and
Okay.
we are from Karnataka. So
Okay.
the rank is 96,022. When we looked at the previous year's cutoff for Hyderabad, Karnataka, there is no possibility of. I mean, what I'm saying is that it's a very tough competition. We understand. So.
Yes, sir.
Apart from this, we are planning to get into. I had a question on BSc Allied Sciences. I mean, can you throw some light on what exactly this course
Yes,
is
sir.
about?
Well, just before going to BSc, I would like to say you will be getting 10 lakh fees is there, sir, in Karnataka. So that is in the private colleges. That definitely she will get, and deemed university definitely she will get. One thing. Second thing is yes, BSc Allied Health Sciences. The lot of scope is there for. As I said, the lot of courses are there, sir. BSc Allied Sciences. So for there, I think in KLE there's a lot of courses are there. In JSS we have, Manipal we have. So the allied health courses are definitely good, sir.
Now, tell me one thing. In case I want to take up a seat in JSS, for example, all right, how much would it cost per year for a medical course?
Sir,
approximately.
So because ours is a deemed to be university, so for a regular fees, it will be around 20 lakhs, sir.
Not it's no NEET rank has nothing to do with it.
So that is again through All India counseling that definitely she will get for this in deemed university. That is
Correct. So,
and Karnataka seats, the government seats are there, only 13 are there, sir, in our college. So that again depends on the category and the scoring. I said that she might not get here. But another management and the deemed university, definitely she will get it.
that private college quotas that we are talking about, the 10 lakh fees, it's not only this college, there are other colleges also.
It's not in JSS, sir. It's not in JSS. It is a deemed universities. You don't have that option. It is only the private colleges. Example like you have in Gulbarga, there is a college, and even Bagalkot colleges are there. Ramaya.
What about Navodaya, Raichur, something
yes,
like
sir,
that?
yes, sir. That is again, that definitely will get in Navodaya. That is 10 lakh fees. She'll be getting, sir.
Oh, okay. All right. All right. Okay. Okay, madam. Thank you very much. I mean,
yes,
we
sir,
were...
that is, sir, when you are going for a state counseling, that is CET counseling, you need to stay here. And then when you are selecting the choices, please make sure that you put all the colleges there.
All right. All right.
You need to send her, when you're choice filling, you should be very careful.
Oh, okay. All right. Got it. Got it. Got it. Thank you very much, ma'am. I really appreciate your help. Okay.
Thank you, sir.
Yeah, so next question from Ajay, please.
Ma'am, my name is Ajay and I am from Haryana. Ma'am, I want to ask, should I consider language of the state when considering medical colleges from different states?
See, if you're getting seat in your, what is your score?
Ma'am, 545.
Okay, if you're getting in your first preference, give it your state. Okay, one of the things, another is the Apex Institute and like JIPMER and AIMS and all. If you get there, you can go there. You can prefer, don't prefer the state. But if you are not getting in a state, definitely the language is not a barrier. Okay, so just because in every college now there is a language classes are there, and definitely you can learn the language, because in the first year you don't interact with the patients, only from second year onwards, and first year they will teach you there's language classes are there. So definitely you can learn. That should not be a barrier when selecting the seat.
So there is no need to consider language.
No, no, no.
And ma'am, those private college seats will be at government seat price, ma'am. Will those be included in All India counseling or state
All
counseling?
India is only 50%, 15% of All India seats are there throughout India. That is only there in All India counseling. The respective 85% of the seats in the state government seats are by state counseling. That you'll be eligible only in your state. All India 15% you're eligible. All India 15%, all of you are eligible. But in your state, you are eligible only for that 85%, not in the other states.
Ma'am, just now you said that there are 13 seats from your university.
Yeah, that is only
Karnataka
students. That is only for Karnataka students.
Okay.
The government seat through our state counseling, that is only for until unless you have some domiciliary set from the state. That is, you need to have them 10. Each state has their own rules for that. 10 years plus 10th or 12th, you should have done. Then you can apply for the state counseling, or your parents are from that state. So each state has a different rules for that. You can go through that. So you are now eligible for your state now, and your parents are from some different state. And if you studied somewhere else, then you're eligible for that state, looking into rules and regulations.
Thank you, ma'am.
Thank you.
So we'll take the next question from Yash.
Yes, Yash. Unmute yourself.
Yes, ma'am. My name is Yash. I am from Gujarat.
Yes.
My NEET score is 459 and All India rank is 1,18,365.
Okay.
Ma'am, today I want to opt for a pharmacy because I am not getting any college at this score.
So that means you don't want to go with the deemed university colleges, right? That means for the higher fees, you're not ready. Ish, unmute yourself. Ish, unmute yourself. We're not able to hear you. But I think it's been muted.
Yeah, there is some issue.
Hello.
Yes, yes, tell me. Yeah.
So I'm not getting any medical college at this score. I'm getting deemed university, but very costly, 10 to 20, 10 to 15 lakh per year.
Yeah.
My family is not that much reliable on
Okay,
that.
then definitely pharmacy is a better, I mean, it's a good option.
Today, one circular passed from our state government that our pharmacy counseling will start from 1st November. And colleges will start after something December. So as we know that this time NEET will come in May. So should I take partial drop or complete drop as December?
See, I would, if you want to go for a repeat, I would say you completely sit and repeat it. Okay, so because going to one college and repeating it's not a good choice. If you want to repeat, definitely completely you go with the repeat. That is my advice. Or you can just join the colleges and don't go to the college, and then if you can continue, but because you need to see there what is there, because sometimes you'll not get the refund or you need to completely pay the fees or something. Rules will be there in each colleges. So see to it that those things will not be affecting you. But my sincere advice is, if you want to repeat, sit completely and study for the next year NEET.
Next question from Adrisha.
Hello.
Yes.
Yeah, ma'am. Ma'am, yes. I'm the father of Adrisa. So, yes, yeah, just my daughter secured 556 marks and All India rank is 45,141. Okay. And we are in the open category. And in open category rank is some 17,450.
Okay.
So we belong to Maharashtra domicile.
Okay. Yes,
so
Maharashtra, a lot of colleges are there. Definitely, I think she will get there.
Yeah. So, ma'am, I have one doubt. Suppose we will be applying parallelly for state counseling as well as All India quota. Yes, suppose in state counseling, she will be getting selected in second round. So, is there any chance of upgrading in the subsequent rounds, mop up and stay vacancy, all this?
Where, sir? I didn't get you.
Yeah, suppose she will be getting a seat in second round of state counseling.
Okay.
Right. Suppose we are not getting a good college, and is there any scope of upgrading the college in third round? I mean, in mop-up round?
Mop-up round, no, sir, because once the seat is allotted and once you get admission, so there is a first round, there is a upgradation option is there. So after the second round, I think Maharashtra also, I don't think so. There's a third round, then I think there is a mop-up round, I think. What is the idea? Do you know? Because as far as I know, because once you take a seat, sir, so first round is you can go for upgradation. That is what is there in Karnataka. They can go for upgradation.
Okay.
And so be careful when you're selecting the All India MCC counseling and state counseling. Sometimes in some state does not go hand in hand. Because also there's a lot of rules is there. So you need to quit some seat there, because once you get admission in one place, you will not be eligible for the other place.
But ma'am, one thing was there was a change in last year, that till last year the whatever state whatever seats were remained vacant in All India quota out of 15%, they were allocating to the states. But this year they have decided that in 15% they will fill in All India quota only. That means yeah. So in that case, suppose is there any what you exactly suggest us, whether in what way we will fill in All India quota as well as in state quota?
Sir, because once what I feel is because for her ranking it's better she takes a state counseling ranking. If she gets a seat there, first round you can see All India, sir. If she's not getting better, let us take a state seat itself, because in All India, because once she takes a seat, she cannot go for All India against a round. And if she quits the state and goes for All India, again she'll be losing this seat.
Okay.
Only
Okay.
if the people who have got more than 650, 670, they can play with this, because if they're very confident, they can go for All India.
Okay.
Hers is definitely she'll get in a state. I would say prefer a state seat. First round,
Okay.
see in the All India, sir. Otherwise, she can stick on to the state counseling itself. Because Maharashtra is also one of the highest colleges. It is there, like Karnataka and Tamil Nadu. So definitely,
Yeah.
I think she will get there.
Yeah. Is there any chances of getting through government colleges?
Yes, sir. I think government colleges, Maharashtra, how many, I'm not very sure. But government seats, definitely she will get, sir.
Okay. Thank you. Thank you very much.
Thank you, sir.
Next question from Syam, please.
Hi, ma'am.
Hi, Sanjay.
Hi, Sam.
I am from Andhra Pradesh. I secured 464 marks and 1,13,846 rank, ma'am, all India.
Okay. So,
And general EWS category 15,000. Hello, ma'am. It any possible to get a private colleges in all India or state, ma'am?
yes, Sam. I can hear.
It any possible to get any private medical colleges
You
in
want
Andhra Pradesh
probably
or
free seat? I doubt you'll be getting the. Yeah, Andhra Pradesh you can get. I think you'll get that is the higher fees you'll be getting, not the government seats. I feel you'll be getting the higher fees.
Private
your seat you'll get, or deemed university. Definitely you will get a seat. Yeah, private
higher
college,
fees
yeah.
means fees for
But not the
per
government seat.
annum, how
Other
much
fees.
cost, no?
Andhra, I'm not sure. Andhra,
Per
I'm
year.
not sure of the how much is that. NRI, yeah, Andhra, I'm not very sure. Andhra, I'm not. Varidhi, I think Varidhi can give any.
So again, I'll have to.
Varidhi, can you just give?
Hello, am I audible, Dipanita?
Yes, yes, Varidhi.
Yeah. Swam, can you please drop your email in the chat for one of our counselors to get back to you, please? And okay, I think Prabha ma'am is here. Maybe Prabha ma'am can take this up. Prabha ma'am? I would just need a minute, Pushpalata ma'am, just a second.
Yeah. Hi.
Hi ma'am. So Prabha ma'am is from Careers 360 and she will support us through this webinar, please. Yeah, ma'am.
Yeah, so what is the question that we are supposed to answer right now?
Swam, can you please repeat your last question? Okay.
Hi, ma'am. Is any possible to get any private medical college in all India or state council, ma'am?
See, you have to be very clear about some things. All India does not deal with private institutes at all. All India counseling deals only with the government colleges in the country, out of which a certain percentage, which is 15%, is allowed in the All India counseling, and the 85% is through the state. Plus the deemed universities. None of the private institutes of any state come under the All India, right? And in the state counseling, you get the private institutes. Now, each state has its own difference. Now, it all depends upon the rank and the state rules on your eligibility, like domicile, study, and all those things. There are many states which offer a management quota, but then you will have to just check which ones are good for you, which state you would like to go, and that's how you have to do it. It is possible. It's not that it's not possible, but then it depends. You know, there are many students like you who want to get a seat in the private institute. So again, the private institutes also have a different kind of seating arrangement. They have to give a part of their seats to the government for the state counseling, and a certain percentage comes as their own management quota, inclusive of the NRI quota. That's how it works. So.
Ma'am, you had a doubt also. What is the fee structure in Andhra? That's what you private seats in.
We just have to check. You see, because the management quota has a different set of fee, and the what do you call the convener quota, as we call the government quota, will have a separate range. It is very hard to remember. Just give me a moment. I'll have to refer to one of my documents, if you don't mind, because I don't remember the fee structures for every single college. So,
yes, definitely. Yes, ma'am.
yeah, it's hard that way. But if you just give me a minute, I'll just check through and just let you know. So would it be for the government colleges or
Private colleges, you want the private seats fee structures. In Karnataka, we have 10 lakhs fees, no, ma'am.
Yeah, see, it will always, differ from
Yes,
10
ma'am,
lakhs
that's
to
what-
40 lakhs. It depends upon which institute it is and, which kind of locality or how popular it is. If it's in the metro, it will have a higher fee structure and all those things. So it will differ. The management quota always differs and there is a cap from the state government on it. What I would suggest is for fee structures, could you all drop us a mail at info@careers360.com, because that's where we can immediately answer properly. It's very vague to give you a fee structure because it differs from college to college. So all I can do is give a range or something like that. And if you need a specific thing, would you be able to write down to us? We have an army of counselors who give these answers. So you can just write down to us. It's at info@careers360.com. So please drop down and just quote that you have been part of this webinar. I'll make sure somebody answers that.
Yeah, and another thing is, see, anywhere, as ma'am said, from 10 lakhs to 40 lakhs, it varies in each colleges. Again, as she said, there's a two kind of private seats also there. One is little higher than the government seats. That is, example, in Karnataka, we have 10 lakhs and management again differs in each colleges. So like that in each state is there. So for each state, you need to, anywhere it is between 10 to 40 lakhs from private seats to management seats or NRI seats.
If you just need to see that, my list of check through. Fee structure.
So probably, according to my sense, ma'am, and Andhra probably around that is little higher fees rate around 12 lakhs and management is around 40.
Yeah, but then again, ma'am, it depends,
Yeah, it depends on the college, yes, ma'am. But the state government would have fixed, no, ma'am, like in Karnataka.
Yeah, the state government has fixed. I've got the document with me. So in Andhra, the convener quota for last year at least was 15,000, and category B, which is the management quota, was 12 lakhs, and then NRI quota was 36 lakhs. This is generally the cap for all the colleges that we have.
Yes,
in Andhra at least. That's how it is. That's for MBBS I'm talking about. If you're talking about BDS, that the range comes down. It's lower.
Yes, ma'am.
Yeah. Okay, I think that's answered for Shyam or whatever it is. Can we go to the next person?
Yeah. Yoganand Masapu, please. Next question.
Yeah, good evening, madam. This is a question on behalf of my daughter, Surya Ishma. We belongs to Telangana, and she secured 527 marks with a all India rank of 63,873. So my question is whether she is eligible to participate in the what do you call all India counseling?
Yeah. See, as
She's
long
eligible.
as long as you've qualified, you've got a rank, you are perfectly eligible. It's the difference whether you will get a seat or not. That is the difference. But there may be chances in the deemed universities. The government colleges, I doubt, because the competition is very high. But the deemed universities will definitely get. See, anyone who has qualified NEET has every right to participate in any counseling as long as they're eligible. That's it. And you are eligible for all.
And how about the possibility of getting in the state quota?
The state gets a better thing. You know why? Because this is the all India rank we are talking about, right? So when you come to the state draws up its own merit list. Yeah. So it will consider only the state eligible candidates. It means they have their own restrictions. For like Telangana state, you have to study there and you have to be a student from there itself, and some rules like that. So the eligibility and the narrowing down of the number of students comes lesser. Whereas all India, you're talking about the entire India, 29 states, and Telangana, you're talking about just a state. So the chances go high.
Okay. So so the question is like there are bright possibilities like she can get in the Telangana state quota, right? For this month.
There are chances. Which, I don't know
So
how.
chances, sir, but because one more again, as madam said, you need to see what is the cutoff for last year. So whether that comes in, because this year it might vary a little bit that and this side, but at least you can guess it whether she'll be able to get, but private seats definitely she will get. But government seats, you need to see the last year cutoff, sir. Because again, Telangana has 36 colleges are there. Chances that she can get.
Yeah,
See, the
thing
point is
that,
like, you know, every government seat also, like government seats again are categorized. There's a category. So it all depends.
one thing, as per the what do you call news in the morning, they said it would be 465 cutoff this year in Telangana.
See, the cutoff doesn't matter like that. How does it work? You know, it works like the number of applicants for the number of seats, right? And that's how it works. And if most probably there are 10 times the number of seats that are available, so it's always the best of the lot that come up.
Rather than score, sir, sir, one thing is rather than the score, so you have around 1 lakh something, no, sir, score rank.
Rank is 63,873.
Yes, sir, because because when they do a state, again they'll give a state ranking. So in that, where does she stand? Because what are the number of students are there from Telangana before her matters when it comes to the state.
She has a decent chances. I feel that that's one of the things that we have to see. What I would suggest again, you know, and I keep suggesting in all my seminars and webinars is like, please make a list of all the colleges that you are, you know, going to apply in terms of all India, and in another sheet in terms of, you know, your state, so that you know where you want to apply. You really want to apply or not. So if you have a list of preferences, you can do the research a little bit. And if you go to the website, you know, the Telangana website, you will find the entire cutoffs of the last year. So if they say 400, that is the minimum cutoff. That people above that will have a chance of a seat, right? Now, but you will want to know which college you want to send. You don't want to send her to a very bad college somewhere outskirts, right? So you need to have a preference. So you can't just take a 400 as the cutoff. So I would suggest that you look into that, and then, you know, you make a decision, make a preference sheet of all the colleges that you want to take into. So everything is given on the websites, you know.
Right.
It's easier.
So one last question. When we say cutoff, that is the minimum marks in the general category, right?
Not exactly. Cutoffs are for every category. There is a cutoff. Now we say now when we say cutoff, it can be in score, it can be in terms of rank. When I say rank, it is the last rank which the last seat got it. You know, so
the last counseling, sir. Last counseling, last seat.
The last rank that got a seat. So if say so many thousands of ranks are there, say 1 lakh was the last one that got the seat. So 1 lakh would be the cutoff last rank. And if you talk in terms of score, maybe 500 was the marks for that. So then they'll say 500 was the score. That's how it works. And also it is, you know, dependent upon the number of applicants for each college, you know. So you'll have to do a slight research on where you want to go. Can you afford this? Can you afford that? And all that. Of course, Andhra, Telangana have a fixed cap for fees and all that. In fact, most of the states have done that. But then again, the management quota slightly goes off. Say in Karnataka, there are very good institutes, but the fees again may vary, you know, different. The deemed universities are slightly costly because that's because they are universities and they give a lot of infrastructure and facilities in terms when you compare it to the private institutes. They are universities in their own right, so they are a different thing altogether. So. Can we move on to the next question, Vaidhi?
Yes, ma'am. So next question is from Jeevan.
Hi, ma'am.
Yes, hi.
Ma'am, this is Jeevan and I am from Karnataka.
Yes, Jeevan.
I got 583 marks and all India ranking is 29,000. So can I have a chance of getting MMC Mysore?
589 MMC Mysore is difficult.
Okay.
So again, once again, you need to see, because this year little slightly vary will be there. So
and
you come to
I belong to
general category.
OBC category. OBC.
OBC definitely you will get. OBC category you will get in MMC.
Yeah, because his rank is 23,000. So
Yeah, definitely you will get. Yeah, general. That's what I was about to ask you. General merit you don't get. OBC definitely you will get in MMC. You are from Mysore?
No, ma'am. I'm from Tumkur.
Okay, definitely you'll get in MMC.
Okay.
You can come try JSS also.
Okay. Ma'am, and the like 3B general category I belong to.
Yeah, in MMC, yeah, you will get. I think probably in second round you will get. First round, I think it's down, but second round definitely you will get in MMC.
Okay.
That's what when you're filling the choice, no.
There are good chances. I would suggest don't keep your options only to one college. Make a list of all colleges. You don't want to lose out. And I've seen students do that. They pick up 10
When you're
colleges
filling,
and
Jivan, when you're filling the form, no, first put your priorities. First is MMC, then college. Fill all the colleges. Only to government. Fill all the government colleges categorically, which you find. If you want to MMC first, then you can put the Atal Bihar Vajpayee also there in Bangalore. So then Chamarajanagar is there. And around you can put the colleges which you feel you want to go. So fill all the colleges. I think 50 or 59 choices are there. Fill all the colleges. Don't leave, because if you are first thing is you cannot change in the second round you cannot change the choices in Karnataka. So first itself because in the another thing is in the mock results they will give, so that definitely you will know where you stand, whether you'll get or not. So according to that you can change your choices. Okay, so careful when you're filling the choices.
Okay, thank you.
Aditi, I think the next question is.
Harsha, can we have your question?
I'm Harsha. My daughter appeared only. She scored only 249 marks, and she has not cleared PCB also as per 50% guidance. We are from open category. Any chances of getting admission in medical or paramedical college?
What is her this one? She's from which state?
Maharashtra, Pune.
But she's not qualified. That's what you're saying, no? So I'm afraid MBBS BDS would not be a possibility. It's mandatory.
No, because there's a 50% you need to board. She has to get 50% in board exams.
Board exam she got 50%.
No.
Group PCB, it's not total 50%. Grouping is not clear.
PCB 50% it should be there.
Okay. But any course then, can you suggest any course from any paramedical, medical?
Yes, paramedical, lot of courses are there, ma'am. BSc are there and physiotherapy is there. Speech and hearing is also again a very good option. And physiotherapy is a good option. And somebody is asking is pharmacy is also a good option. So all of the paramedical courses are picking up, ma'am. Lot of scope is there for paramedical.
And BMS and
definitely
BHMS
lot of
also,
scope is there.
for BMS and BHMS also is required PCB cleaning.
Yeah, it's through NEET.
Okay.
BHMS,
So
BUMS.
Can you suggest which colleges can we get in 249 marks for physiotherapy? Any good college?
We'll just have to see. Could you just do, because there are a number of colleges.
Maharashtra, I'm not very familiar with Maharashtra, ma'am. I think
no, I can. Sorry, I can get that answered. But would you drop us a mail, because this would require a little bit of delving.
Okay, madam.
Yeah, please drop us a mail at info@careersystem.com. One of the.
Definitely. Thank you, ma'am.
Thanks.
Thanks, Harsha. So the next question from Devarsh Gandhi, please.
Hello, ma'am.
Yes.
My name is Devarsh Gandhi, and I scored 580 marks in NEET 2022. My rank is 31,423. Can I get a government medical college in Gujarat?
Definitely you will get pa.
Ma'am, can you suggest few of them?
Devansh, no?
Devarsh Gandhi, yes.
Devarsh, can I suggest something? We have the list of good medical colleges on our website. Would you take the trouble and check that out? There is also something called NIRF. There also you'll get ranking, but actually a good list will be available on Career System. So if you just check that out, you can. Otherwise, you can even write to us. But I'd suggest you check it out. Simply because you ought to know what are the good colleges, and you have to be able to make the decision on your own. So
Yes, but
yeah,
can I get a government medical college?
you should be with that kind of rank. It's a good chance.
Yeah, first
Thank you,
try
ma'am.
with the first choices when you're filling, put the government colleges, then you can see which is the good
There-
private
there-
college and you can fill it.
There is a good chance. So you just have to try it out. But again, it depends. So not in. I'm not sure. It's 31,000. Are you which category do you belong to? Because
Open category.
okay, 31. Okay. So and how many marks did you say?
580.
580. Okay. You have a very good chance. You should be. But just put the choices properly.
Thank you.
Where is the next question?
Kanu Kamalia, can we have your question, please? Kanu?
Yes, ma'am. Good evening.
Yes, good evening.
Yes, Kanu.
Ma'am, I am from Gujarat, and my brother scored 640 marks in NEET. And his all India category rank is 2,473 in OBC category.
Okay.
And my question is, he wants college only in Gujarat, so he should participate in state counseling only, or he should be participating in all India and state counseling both?
He can get in all India also, state also he will get.
Yeah. So he can choose the Gujarat colleges, but why is he restricting himself? Because he has the chance, to go into very good colleges.
Yeah, aims at Jipmer he can go.
Ah.
But like he wants to stay only in Gujarat.
That's a very bad choice, frankly, if you ask me. Yeah, because as a student, you shouldn't stop yourself. You should be able to learn and go move around and then understand. If you're going to stay back here only, it will be like the small area only that you want to. You can always come back with all the experiences and then settle down in Gujarat and practice there. Because you're getting very good college, you have every chance of getting very good colleges in the All India counseling, and you should be able to take them, and they are much more brilliant than the government colleges in Gujarat. Why would anyone choose that? Please talk to him. It's not right.
Okay, thank you, ma'am. And what are the factors he should consider while choosing college?
The very good rated colleges, if you want to see, just check on Career 60 or even go to
I would
NIRF.
say you don't think of any other colleges, just think of AIMS, Delhi or Jipmer, Pondicherry. So definitely he will get there. So don't think of any. If you want to go out of Gujarat, either go to Pondicherry or to Delhi.
Okay, thank you, ma'am.
Yeah, next question from R. Ray.
Yeah, this is for my daughter. She's got a score of 509 and all India rank of 77,258, state of Maharashtra. What are the possibilities of finding a government medical college or a government seat in Maharashtra?
Sir, government medical college slightly doubt, but government seats in private college, I think he will get it.
What are the fees for government seats in private medical colleges?
So your madam will be able to help you out with this.
Because I'll just have to check again. Like I said, I don't really remember the fee structures that they have. I'll just get back on this because I just have to search again. The fees are for the private colleges are generally, given in there's a fee regulation committee for Maharashtra too. I just have to search now because I'm just not. Just check if I can get it right away. Otherwise, I'll just, get back. Okay, good, good. So if you're talking about the private colleges, total fees, for example, KJ Somaya last year was around, tuition fee was 9 lakhs 27, that's around 10 lakhs plus, you know. So it goes around like that, you know, and there are some which have 70 lakhs also, and there are some which have 7 lakhs, sorry. There is 8 lakhs, around 10 lakhs to 16 lakhs. That's what I can find out. Depends upon the college. You just have to give us a list of the colleges that you are interested in, and then because the colleges' fees are separate, they have been approved by the fee regulating authority. But I see a huge difference in college to college fees, unlike the Andhra and Telangana thing where there is a cap on it. So I would suggest if you could write down to us, you know, about the colleges, then you can find it out. Otherwise, there is a website of theirs. There also you will see, you know, the fee regulation thing, and there it's clearly given also. Hello. Yeah.
Do we move on to the next question, ma'am?
Yeah, we should.
Kanak.
Hello.
Yeah.
Am I audible?
Yes.
My daughter Kanak has scored 181 in NEET, and her rank is 5,99,000. So what are the options for her? Because she has given only NEET with PCB.
NEET is only PCB faculty, but chances are, you know,
Sir, you're looking for only medical seat or any other option of any other course you're asking?
Yeah, medical plus like paramedical kind of thing.
Sir, medical, she'll be getting the NRI quota, the management medical she can get because she's eligible. But paramedical, definitely she can join any other paramedical course, sir. BSc Allied Health Sciences, physiotherapy, speech and hearing, all that is good, sir. She can join any of the paramedical also. There are also good options.
And in like deemed university or private colleges, what would be the expenses?
Again,
Sir, it
depends.
is anywhere around, it is for the NRI seats, anywhere around it is 35 to 45, it is there, sir. 35 lakhs per year to 45 lakhs per year.
Okay. Thank you.
So you could also, you know, look at some of the states which do allow others, you know, applicants from NRI, but we'll just have to sit and see, because they sometimes change the eligibilities. But other than that, which state do you belong to? Okay. Yeah.
I think we're studying from Maharashtra, ma'am. I think so.
Yeah, Maharashtra. Yeah. Okay.
Next from Disha, please.
Hello.
Yes.
Am I audible, ma'am?
Yes.
I'm from Karnataka, and I wanted to ask Pushpalata ma'am that she said in her university 13 government seats are there.
Yes.
And what should be the minimum cutoff for that, ma'am?
What is your score, ma?
I scored 568, ma'am, and my category belongs to OBC.
OBC, I think you will get in JSS because OBC, I need to see because out of 13, general merit is only 5 seats are there. OBC, I need to see how many seats. So probably 563 you will get in JSS. You might get in JSS. I would not say 100% you will get. You might get in second round. You might get in JSS.
Ma'am, what would be the fee structure if I get a government seat in there?
Government seat, it is 1 lakh, 1.5 lakhs plus some amount around 25,000. Some other fees will be there. Probably around 1,75,000 it will be.
Okay, thank you, ma'am.
All right. Next question from Gyanesh, please.
Ganesh?
Hello.
Okay, so
Ma'am, basically I've got a rank of 23,126 with a score of 595. And through Maharashtra State Counseling, I would like to know that what are my chances in the Grant Medical College, which is in Mumbai. Last time the rank went till 26,335. So I don't know what would be the cutoff this time. So could you please suggest?
See, the last rank always is till the spot rounds. So you'll just have to wait and take a chance. That slim chance always remains.
No, ma'am,
Every
the 26,000 is for the second round last time, not for the last three vacancy round. So that
Okay,
second
so
round went till 26,335. So
then
what?
there is a chance, because the cutoffs don't vary so much every year. They just vary slightly here and there.
Yeah, and I think
Yeah.
looking at the results this year prediction, it is the little rank is little gone below. So probably there is a chances that you might get there.
And the factors again, it all depends upon the number of applicants. But if you look at the cutoffs of the last years and all that, good chances like that. Yeah, second round you may still get it.
And
Because
ma'am,
the
like
way
if I have to compare the two cities, like basically three cities I have in which I can get colleges, which are Mumbai, Nagpur, and Aurangabad. So, in which order should I prefer them? If I have to give a preference list, Mumbai, Nagpur, Aurangabad, based on exposure and all those things.
See, all three are very good places simply because I feel that Mumbai is a different ball game. Nagpur has its own, it's a very big city, and the surrounding neighborhood towns and all depend on that. Aurangabad is again like that. So there is nothing like a comparison. It would all depend upon how you would feel and where you want to join. So
You're from which place?
Yeah.
Actually, ma'am, my father is in a transferable job. So basically, we keep transferring every 2 to 3 years. I'm comfortable in any place. But seeing from MBBS and medical point of view, which city can give me much more exposure and, the patients, I can see more types of patients and gain more experience.
See, you're talking about Mumbai again. If it is Grant, then that's a very big hospital attached to it. So there's exposure. Then Nagpur and Aurangabad, you have to see which colleges you're getting into. So, and
No,
all
one
of
thing
them
is in
from
any
yeah,
of the government
yeah.
colleges, patient input is very good, ma. So don't think of anything. Government
Yeah.
colleges definitely
What
patient
you-
clinical exposure is very good.
What you have to see now is the fees, because apart from the fee that you're paying to the college, most of you should also consider the fact that you may be probably living in a hostel or someplace. You will have other expenses to boot with. So these are things that you also have to consider. So compare that way. Also check what the ranking is, what the faculty is like. That way you can make a better decision.
Yeah, and
Right,
one more thing
yeah.
is, when you're selecting, one more thing is don't think only government colleges, because the new government colleges, the faculty might not be there. So teaching is actually, I would say teaching is definitely better in private colleges. Clinical exposure is better in government colleges, but again, you need to think both the teaching as well as clinical. So some of the private colleges where the teaching is also good, clinical exposure is also good. So you can think that and prefer that. You can take the feedback from the alumni or the student from there. So the clinical material in private colleges, if you prefer to stay in Mumbai or anywhere, so you can consider these things also.
Okay, ma'am.
Yeah.
And as in Mumbai, like we have many colleges, so I have main confusion between Grant and Cooper. I'm not sure which one is better because both of them have equally good reviews. So could you please suggest?
Both are equally good. If you get it to one of them, take them.
Okay, ma'am. All right. And with this rank, should I also go for all India quota?
See, I don't know whether I see Ganesh here. Let me tell you something. The doctor that you become will always depend on you. The college is just a means, the place where you will shape yourself, right? So if you go to a good college and you work on your abilities, I think you should be a good doctor. So any college that is, if you are a very good person, you have that drive and that focus, then you should be doing the best. So think of it like that.
Okay, ma'am. All right. Thank you so much.
Next question from Kunal, please.
Hello.
Yes.
Good evening, ma'am. Ma'am, I'm Kunal Sinani from Maharashtra. This year I have gained 607 marks and rank of 17,905. So can I aim for BJ Medical College or Sion or KEM in Mumbai?
Sorry, I can you just repeat the question? There was something.
He's got 607 score. So can he aim for KEM in Mumbai?
You should aim. See, I can't give a guarantee you'll get and all that because that's very good score. But you should. You have chances to.
For BJ
So that
or
is why
KEM?
whenever you fill the choice, no, you put all the colleges. So for your rank, definitely which is the order which you want the colleges you put, because you don't judge yourself that you might not get in KEM. Put KEM as your first choice. You might get or might not, but put that as a first choice.
So how does this choice filling work as it? So you will put the best college that you want in the first place, the second best in the second place, and all that. Right. So in the first round, you may not get it. So you may get the 10th choice that you have put in your list. Okay. The second round, maybe some things have got vacated. You may get the third one or the second or even the first one in it. So the second round will also be a chance where you can, because they don't consider anything below the allotted seat. They will consider only the choices above the allotted seat. So if your 10th choice is given, then from 9th onwards only they will consider. They will not consider anything below. So the choice filling goes like that. So be assured on that. Fill all those good choices that you think you want to apply for and that you want to see. So if you don't get KEM, there must be something else that you want to get into. If not this, like that you do. Right? So that's how you have to do. Yeah.
Okay. Hello.
Yeah.
Yes.
Yeah, ma'am. I have this EWS certificate by central government. So can I use in state quota also?
I think the EWS works.
No,
I just. Pardon?
No, ma'am, I don't think so. That is it. I think it is only for all India.
Only for all India quota, no? This only for
Yes.
So to this state quota, I have to apply by general category only.
Yeah, with Maharashtra, I'm not very sure of it. I think Prabha madam can guide you on that. But as far as I know,
as far as I know that they will require a local this thing EWS, because if you're from Maharashtra, then it shouldn't be an issue.
Okay. See, I don't have this state EWS certificate. I issued by this central government.
Okay. Could you just drop your email down in the chat box? One of our counselors will pick up. I'll just try and get back to you on that.
Oh, okay. Thanks.
Yeah.
Email that.
Yes.
No, I think whether it is state or this one, I think it does not matter. You can apply.
EWS, I'm not very sure, ma'am, because the category certificates always matter. When the All India thing comes, in All India counseling, you need the All India ones only. That is how they will take for the 15% quota or the deemed universities. But the private ones in the state counseling, you need the state category certificate. EWS, I'm not very sure. I'll just need to check once again before I give an answer. That's the reason why I
Because
asked.
you have already from All India, you can take from the state also.
Just
what is the rules for the state, and you can take it because it is not difficult to get it.
I'll just check it out. The brochure will be having the details. It just is a matter of checking through. Please drop your email. We'll get back. Vardi, can you ask somebody to Dipanvita? Can you just ask somebody to make a note so that we answer this back? This is a very interesting question, frankly. Okay, we'll do that. We'll get back to you definitely. Vardi, move on to the next question. We have a lot of people have raising up their hands.
Hello.
Yeah. Dalitesh.
Ma'am, I'm Laldesh. I have scored 486 marks, having a national rank of 94,694.
Okay. Oh, your voice is gone.
Lalitesh, we cannot hear you.
Yeah, your voice is now no. You're not audible anymore.
Hello.
Yeah, please repeat yourself. We couldn't hear beyond the
Ma'am,
fourth.
I have scored 486 marks in this NEET.
Uh,
My national rank is 94,634 rank. Ma'am, can I get the MBBS college, whether it's a private or government college in Andhra Pradesh or Telangana? My locality is Andhra Pradesh.
then you have to try more in Andhra Pradesh because the eligibility local thing plays a role in Telangana.
So one thing is, if you want to try in Telangana, see the rules and regulations, because that is a little again confusing. But definitely you can try for a private seats in a private medical college. Then government seats in a private college is also a little doubtful. But private seats in a private colleges you can get.
Ma'am, my category is OBC category.
Then you can think of, because you first thing is last year's cutoff, if you know, then you can try the government seats in private colleges.
Yes, ma'am. Last year, Andhra Pradesh we have two regions, SVU and AU regions.
Yeah.
AU regions last cutoff mark is 505 and SVU region having a 488 cutoff. In this year, I have got 486 marks. Whether I can get a chance of getting MBBS college or not?
There is a slim chance, sir. So we can't really predict whether you'll get it exactly or not. There is a slim chance. So that's what we can just say.
Yeah,
I can't
it
guarantee.
Depends on what is the number of students before you are there in your state. So that matters.
Applied, you know?
So it is again just you can take a chance of this.
Okay, ma'am. But ma'am, last year Telangana cutoff is 471 for BCD mark.
Yeah, but are you eligible to apply in Telangana?
Yes,
Under the
ma'am,
non-local, yeah.
But that would be a non-local to that.
Okay. So then you get a chance of getting you is little high than Andhra Pradesh.
We see Siddhartha was last year 480 last. So there is Vishnu Bharati. There is a chance. That's what I said for Andhra. With the kind of, but again, you know, this is a very slim chance because it depends on the number of applicants. So normally, like I said, the cutoffs don't vary so much, but that one or two here, there, that happens. So if the number of applicants are more and there is more competition, then that's slim chance. That's the reason why I said slim chance, but there is a slim chance. We're considering the last rank.
Okay, ma'am. Ma'am, another question. What may be the fees if I get a private college?
For Andhra, I just told you.
Can you please
I'll
check?
just have to open again. Just give me a minute. You want for the government college? Indian in minority, that's what they have given. See, for the government colleges, I don't remember now. I have to just check that. I just have the fee structure for this one. Private ones, right in front of me. I think you can just check out. Yeah. This is for the Andhra Pradesh thing is for medical. It is government colleges is 10,000. That's what you pay, except for Sri Padmavati, which is for women anyway. So government colleges category A, that is the convener quota, 10,000 is the amount that you have to pay plus a university fee. 10,000, something like that.
Private A?
Private, what is private A?
In private, there will be category A and category B, ma'am.
Category B is around 12 lakhs, I think.
Yeah, 12 category, yeah. 12 lakhs is category B, but government quota in private colleges, which is what comes now on the 50% of seats, that is 15,000. So in a private college through state counseling, you're getting the government quota seat, then you have to pay 15,000.
Oh, okay. Ma'am, if I get a private A, then what is the fees? What may be the fees?
Private A, that is the government quota for the private college, no?
Yes, ma'am.
That is 15,000. Unpaid. 15,000 per annum.
Okay, ma'am. Ma'am, there someone says that there is a per annum there are 2 lakhs, 3 lakhs for a private college.
See, this is the basic fee that they have given. Plus, you'll have to add on the university fee of 10,000, 10,500 something because you're affiliated to university. Plus, you will have some more when you have some admission charges and caution deposit and all those things. So you will have to have some like that. This is just the
Again,
basic fee
depends
as
on the
given in
private
the
college. Again, depends on the private colleges, pa. The fixed government seats, the fixed is that 15,000. Top of that, there's a library fees and the other fees will be
sports fee, some conveyance fee, some caution deposit which is refundable, university fee anyway you have to pay, one exam fee, like that they will have. So you have to check out that. But
Ma'am,
basically this is tell me.
Which state has the least cutoff, ma'am?
Prabha ma'am,
yeah.
Because of the time crunch, can we please wind it up at this point? And
We'll just take this last question he was asking because he is already in the middle of it. Yeah, tell me, Lalitesh.
Ma'am?
Yeah, you had one last question you were asking.
Ma'am, in India, where can I able to apply for the for the counseling? Which I will get the more chance to get a seat in MBBS?
Best is being in Andhra Pradesh because you belong there, I think, and you're a local candidate. So the chances in the state. Other than that, you'll have private colleges only in other states. All
Yes,
India,
ma'am.
you'll have to see, but government quota, I don't see much of chances there.
Yes, ma'am, there's no chance I have been in.
Yeah.
Ma'am, but other than Andhra Pradesh, whether it's private, where can I get a more chance to get a seat? Whether it's Andhra Pradesh or Tamil
But
Nadu?
you will not get the government quota in the private colleges. Please mind everyone. You will not get the government quota of the private colleges in any of the states because that is only for the state residents.
Okay, ma'am.
It is not open for any other. So you will have to only apply to the management quota of any other state, which again comes to higher. And generally it is around 10 lakhs across. Minimum that is the minimum that you may be required. 7 to 10 lakhs.
Per annum or total 5 years?
No, per annum.
Per annum. Okay, ma'am.
Okay.
Thanks,
Yeah. Okay, I think we're going to wind up because it's already been so
just
long.
1 minute, ma'am, Prabha ma'am.
Yeah.
Anybody who's has any doubt, especially the Karnataka students who could not ask the questions, please feel free to email me. I think you can take my email. So for the Karnataka, because I know what are the things, I can definitely help you. Others, if you have any doubt, please you can contact me also. As a 360 is there, so you can take my also pushpalatake@jssuni.edu.in. So any queries, just you can email me. I'm ready to guide you in any aspect.
Yeah. So for any of the Karnataka related or JSS related, be it medical or even paramedical, you can definitely mail down Dr. Pushpalata. She's been kind enough to give an email. Can we just put that on chat also, please?
Chat, I think I was just trying to put, I think I can type only to the carrier 360.
Okay. Or you can just, pass it on Varadi. She'll just put it across. And please write down for all of those we have not been able to answer. We'll try and answer your queries. Please write down to us at info@careers360.com. We have an army of counselors. We'll definitely try and help you out with things. So I think that's where you should write down to, and we'll get back to you on all these answers.
All right. So thank you so much, Dr. Pushpalata, for sparing your time and joining this session with us. All the students who still have any questions, please feel free to write to us at info@careers360.com or ask@careers360.com. And we've also put a link to a Google form in case you have any query. The link is there in the chat. Please do fill it and one of our counselors will get back to you at the soonest. Thank you so much once again, everyone, and all the very best for your college admissions. Thank you. Bye-bye.
Yeah, all the best.
Thank you, Dr. Pushpalata, for being in.
Thank you, Prabha ma'am, and thank you, Varadi. Thank you.
Thank you, ma'am. Bye-bye.